Today's morning medicine. I thought it was a D, Debola, but it's Ariana, Aranea, sorry, Aranea, Ixobola. I don't know where that came from, but it's a cross spider. Same as the last one, Aranea diadema, was the papal cross spider. So I don't know how much difference. We're going to find out. This still has a lot of the nervous stuff in that. And like all spider remedies, they have the nervousness, the inner nervousness, the always moving around type of things. So Aranea ixobola is a cross spider which lives in Europe but was imported from America. It's an American spider. Pooch has examined the venom which comes from the Chaliceria. The dried venom represents 30% of the original poison. Okay, J. Mergzer. Now, this is the important part because this is where proving was done. J. Mesger undertook a homeopathic provings in 1952 at the Robert Bosch Hospital in Stuttgart. It sounds like Germany. It probably was. That's where Hahnemann was for a while. At the time when Dr. Otto Leeser was director there. Okay, so these guys are conducted in 1952. So this is a little later than the 1901s, the 1920s, when homeopathic medicine was in its prime, and then it got taken over by the drug manufacturing situation. 32 provers, of whom 7 were women, and all were doctors, participated in this. So all the doctors participated in this, and it's just interesting because you make yourself sick with this stuff, and then you report your symptoms. So I don't know, 7 were women and the rest were male doctors. So, anyways, uh, when you do a proving, you basically take this thing until you get the symptoms. You take whatever it is, and it's homeopathic, so it's not you're taking poison. So you can do a proving, which they've done on arsenic. And when they do an arsenic proving, they dilute it out. I don't know how far. Arsenic's pretty poisonous, so you can't be in the lower potencies, I'd imagine. Get a little higher up there, and then dose them. Now, if you go real high, you could dose people that are, that'll get real sick. Now, you have to be susceptible to the medicine first off, otherwise it does nothing. So, anyways, you give the medicine, and they keep taking it until they overdose. Now, if you have a plant that's not poisonous, you can take the tincture and give a proving that way. So, anyways, let's get into it. Aranea. Oh, my wife's legs. Phosphoric acid seems to be holding. We're gonna see what happens here. This is the first week, I would say, out of I don't know, probably a year that her legs had just been aching, and I've been pushing on them that. And I was aiming for the bad foot with the bump on it. I don't know what that bump is. Going with tendons and stuff. Nothing. Then I went with deep pressure, Ruta. This. So kelp carb seemed to palliate the pains in her legs at night. But the only thing that really worked was that deep pressure. And then, like I said, if you don't hit the center of the case, you're looking at the problem. So if I'm looking at like that doctor with the ear cancer, I'm looking at the cancer in the ear and what remedies will cure that rather than the stress he's under and the stomach problems he's having that has given him the ear problems. And so like my wife, she's got a bump on the bottom of her, in the middle of her foot. There's a hard knot on it. You can't hardly touch it. She can't. She was having a hard time. She couldn't walk on it, and she drinks a lot of soda pop, so that's phosphoric acid. Not that's I'm telling you, that's how I got to that medicine. I was in a deep, the deep pressure. Like the what is it, the perineum? No, 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 no. The sheath that covers the muscles. I'm thinking, okay, it covers the bones and muscles and all that. I'm pushing so deep, so I went into that perineum. I can't think of what it's called. Anyways, I went into that section under legs, and I went to the perin. Oh man, I forget what the sheet is called that covers it. Anyways, that's why I say you can do this. It doesn't. You're not obligated to know all these terms and all this stuff. You can always look it up, but the main thing is looking at the case. When you learn how to look at someone and you can determine, because we look at the problem. I'm looking at the foot, I'm looking at the legs are aching, I'm looking at, but then you got to go back and look, where's this coming from? What's the contributing factor? What's the center of this case? And so I got a bunch of medicines under there, the perineum, something. I don't even know if I'm close on that. But it's the sheath around the leg. I'm looking under that in the repertoire, under legs, under I think pain, and then that word I think I can't remember what it is, but anyways, I'm looking under that word, and when I look under that word, then I and you can tell this is off the cuff. Otherwise, I'd have looked up what it was, and I could look it up now, but I'm not. Uh, so I'm looking under that, and I had a few medicines. So I looked under the medicines, and the one phosphoric acid that was there with that deep pain in the legs and that was phosphoric acid. And I'm like, and when I read it and it said loves bubbly soda, and I'm like, man, that is that's the center of the case. And then I started thinking she's acidic, got to neutralize that acid in her somehow, get her to drink lemon water, light lemon water. The one I drink, she says, holy heck, you put a ton of lemon in that. So anyways, I I gotta neutralize that. Not only take care of it with phosphoric acid, she still has a little left, she said, in her bottle of water, which is what I always give people. And she has a little left, and her legs haven't hurt. But then I've got to figure out how to get things in her diet that is more green, more at non-acidic. Any carbs, meats, all the lunch meats, all the stuff that's all acidic. What is it? Broccoli and vegetables, and what the funny thing is, I get her Ichibon. She calls it Ickabees. She's so funny. She calls it Ickabees, but it's Ichibon Steakhouse. I bring it home, and she eats all the shrimp, noodles, and rice, and she leaves the vegetables for me. So I don't know what to do there. So, anyways, so that's the health coaching part, to try to turn that around. Get a green drink or something. Have her drink that once a day. I don't know if she'll be able to do it, but yeah. So I'm just glad it's holding. Now, the idea is I've got to keep an eye on it and see, if there's a relapse, or, do I go to a higher dose to finalize it? Do I drop back potency? I mean, drop up a potency, drop down a potency. See, when I get in that water and they just start pounding it, taking it, as often as they remember. I always say 15 minutes because it's usually every hour or something. Then you start seeing some results. Now you can adjust and you can back off and say, oh, okay, quit taking it so much. If you're getting aggravated or something's going on, or it's doing better, I can adjust it up and start taking a little more. Take it a little more frequently, or I can go up a potency. If they're aggravated, I can go down a potency. If they're doing well, I can try an upper potency once things seem to plateau. Hit a higher potency, and then then you might see, like I say, there's within a layer, there's stages, so you'll see them come out of that, and then all of a sudden a new picture will present itself. Now, if you read that picture right, you can either change a remedy, or you're going higher with that remedy, whatever. But they'll discharge that whole layer, and the layer can come from a grief, an injury, whatever. That layer's put on your vital force. Yeah. And it has to expel that. It has to get rid of that. Now, that can last for years, and years down the road, you got problems, and it all stems back to that historical, like the lady with the TMJ. I gave her Nat Sulf, head injury, TMJ. Uh, I gave her Nat Sulf for a surgery. I wasn't even going for TMJ, and it cleared it up. That's when I first started. I was like, oh, cool. Another one in the repertory, TMJ, possibly Nat Sulf. So, all right, let's get into it. There's no case taking today, so that was the case taking part. Aranea, Ixobola, cross spider. Digestive disorders, especially in gallbladder, spleen, Neurotropic. Oh, so all the gallbladder, spleen, whether it's a gallstone or whether it's whatever, any type of digestive things going on, and especially the gallbladder and the spleen. Neurotropic, which is the stuff in the spine. It has to do with the spine. Is that what it was? Anyways, and vascular effects. So nerves, yeah, it's nerves. So basically, nerves and the heart action is affected. Better drinking, and don't forget, this is a poisonous spider. So yeah, they have those venoms are used to paralyze people or whatever, damage them so that they can evade, not people so much as other animals, that they can eat them. So anyways, better drinking coffee and smoking tobacco. So they want stimulants. They love stimulants. I think alcohol. There's alcoholic tendencies or something in this one. I'm pretty sure. Anyways, yeah, I'm pretty sure that's what was in the beginning. Worst, rest and cold. So they can't sit still. And as a spiders, any spiders, tarantula, we have a medicine out of that, and any spiders, they're moving, 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 excited, can't they can't rest, and they don't like cold. Okay, let's go. Mind. Euphoric state, as if drunk. Loquacity, which is talkative. They're very talkative and euphoric and up. Followed by melancholy, maniac, and depressive psychosis. So manic depressive, and that's what they said Jimi Hendrix was, manic depressive, I think. But have real high moments, have real low moments. And a lot of people who are high achievers and that have that's going on. Inner disquiet and hastiness. Nothing gets finished. So this person will come in like a fireball, and they'll start uh, doing things and getting things ordered, and then they'll go away and do something else. And so they get this just inner turmoil going on, and there's an inner trembling with this, which is from that spider's venom. So these guys poisoned themselves, had these states, right? and they wrote them down, and then I don't know if I don't know what the antidote for this one would be, but anyways, they would all them doctors and them seven ladies, they took this stuff, and this is what happened to them. And then when you see that in another person, somebody that's sick, and they come to you and they have this manic depression and they inner turmoil, and you notice they can't sit still and they're just moving around, they're shaking their leg and they're moving, you'd start considering a medicine like this. And then they come again next time and they're down and depressed and they're not moving, yeah, you'd be really pointing between Aranea Ixobola and Aranea diadema. What the heck is that? Diadema. Yeah, those two, they have the same thing. And there's, like tarantula has that sort of inner disquiet and that nervousness. And what's the other ones? There's a couple of them. I don't know if I'm reading them or not, but euphoric state. Okay. After meals, nausea, heaviness in hepatic region. So the liver and that down there, when they have a meal, they get problems, and in the gallbladder. Shooting pains. So they get these shooting pains. They get this uh, problem. That's why it says digestive disorders. Many digestive disorders. Now you notice there's not a three. I didn't underline any of this because none of it was a three. And there was some threes, I think, in diadema. Diadema. It's from yesterday. So, anyways, that's probably well, they both were obviously proven, to what extent, I don't know. Stiffness, snape of neck extends to shoulders, and that trapezial muscle back there. Lumbar pain, can't work several days. So, people think, oh man, I woke up, my back's hurting me, my this, my that. And it can be from lifting. If it's lifting and stuff like that, then it's, bryonia, rust talks, depending on the symptoms. One's better, bryonia is better, worse movement, rust talks, better movement. So, yeah, if it's a lifting injury, it could be many other medicines. But sometimes this guy can't work for several days. And sometimes it's a different situation going on that would require different medicine. You ask them what happened. Well, nothing. I didn't lift nothing. I took a step and oh, my back went out. You know, Really? What's that from? So, you know, that's when you start realizing that the vital force in attempts to try to throw off certain things will actually, for lesser organs or lesser areas, will allow pain and whatever to happen. Trying to throw off whatever sickness, whatever things going on inside. Um, so it's not always, hey, I lifted something. I've heard people say, man, I just took a step, or I just bent over, and oh man, now my backside, and I can't do nothing. So, yeah, Aranea, Ixobola might be the remedy for that. Angina pectoris, heart problems. That's that. Where is it? Neurotropic vascular. That's the vascular stuff going on. It affects the vascular system. Hypersensitive to noise, so they can't take loud noises. No eyes, no face. Female menses early by a week, preceded by blood-streaked leukorrhea and disorders of the libido, which whether it's high libido or low libido, it basically messes with the libido, which is the sex drive. Blood-streaked leukorrhea, which is a discharge in between periods, but it's blood streaked, and then the menses come on early by a week. If you're early every week, then you're on time eventually, right? You're so far ahead of yourself. You feel like you're so far ahead. You feel like you're winning. Aggravated by fatty foods, especially pork and alcohol. So they can't take alcohol, but I don't doubt with drinking coffee and smoking tobacco that alcohol is a problem too. Desire sugary foods. It probably is because my mentor Robin Murphy, he said alcoholics or people that use alcohol, one alcohol, they they're just craving a certain type of sugar, and that's basically what alcohol is sugar. So yeah, there's a whole sugary thing with alcohol and that. But this fatty foods and pork and alcohol, it's that digestive disorders. They just really messes with them, and then when they eat a little bit, shortly they're like, okay, my what is it? I get nauseous, and in the hepatic region, down in the liver region, and the gallbladder is shooting pains. And that's shortly after eating. Aggravated by fatty foods. Okay. Deafening or stinging headache, especially right side after mental effort. And you'll notice I read when they pee, they get to urinate, the headache goes away. So there's a deafening or stinging headache, especially right side, and especially after they use their head. But when they have this headache, once they are able to urinate, because of the liver and the gallbladder and all them problems, it releases that headache. So where's that headache coming from? It's a gastric situation. Strong palpitations and squeezing in the heart, feeling like, man, something's squeezing my heart. Accelerated pulse, aortic deficiency. So the heart starts not working well. Overpowering need to urinate. And I'm sure they had stethoscopes and they were checking this stuff, and these guys were being tested too while they were taking this stuff. Overpowering need to urinate, which increases or with increased or decreased urine, and polyuria, which is excessive urination. So, but when they urinate, in the book it said, the headache goes away. Trembling hands, increased rheumatic pains in all joints. So the hands tremble, and they have rheumatic pains in all their joints. So there's rheumatic arthritis going on. Left-sided sciatica from standing too long. So they stand too long, they get this left-sided sciatica. Oh man, so then it's better by moving the leg. So they either got to shake the leg or move the leg or get up and walk around. Heavy, swollen right arm with clumsy hands. So the right arm is swollen and the hands are clumsy, grabbing things and dropping them in that. Persistent, irritating cough. Speaking of the hands, my mother, she's got carpal tunnel. So anyway, she won't take the medicine. I gotta sneak it into stuff. I'm ready to go up there and say, listen, this is Ruta. It'll take care of your carpal tunnel. She went to a doctor. He did some surgery and that. Nothing's better. Nothing happened. So I'm I'm really just want to go up and say, here's a bottle of water. I'm putting these little sugar tablets in. You pound it 10 times, sip it, and keep doing that all day and all day tomorrow. You know, I almost guarantee her carpal tunnel will go away. She can't grab a pen and use a pen, but yeah, but to get it to her, it's gonna be a whole another ball game. Too bad I couldn't go through the white coat doctor and say, "Hey, give my mother this bottle of water, would you?" And tell her it's your medicine. She'd believe him. All right, no liver, right? Well, liver hepatica, whatever. Persistent irritating cough. Every breath is painful. Chronic asthma. So they got this is a good asthma remedy. Uh, every breath is painful. So trying to breathe it in, oh, it hurts her chest. And persistent irritating cough. They can't get rid of that cough. Male, diminished libido with cold genitals. Increased libido with insufficient erection. So either way, depending on where they're at with the disease, they could have cold genitals with no action, or they could have increased action with not being able to perform. What a predicament he's in. Dry feeling, mouth and pharynx. Bleeding, gingivitis. So their gums are messed up. That's a mercury symptom. Cracking of lips. Aphthay, which is vesicles all in the mouth, sores. Sharpened, perverted sense in the nose of smell. So the smell and the hearing is perverted. Irritation, mucous membranes, water's coming out, watery mucus comes out of there, but it's irritated the membranes, and hypertrophic rhinitis. So the membranes, not only is there water dripping out of the nose, but it's swollen up. Um, my sister has sinus stuff, and I gave her one medicine. I'm like, so now I gotta once again say, okay, honey, I gotta sit down. I gotta take your case and figure out, okay, what's going on with you? You know, where's this coming from? This sinus thing. Now my dad has sinus issues too, so she takes more after him. So yeah, it's yeah. Sometimes, to get symptoms out of people because they think allopathically. I just got a stuffy nose at night. I lay down, looked that up, tried that. Lying down, nose stuffed up, lying down. So there's something different. I tried. I think she tried some allergy pills or something. I told her to get some sinus pills. Homeopathic, they put 20, 30 remedies in there. You don't have to guess. You just take one of them, and one of them works. But now you can't take the case. You can't, once that clears up, you can't get to the root of it, and you can't peel off and, say, oh, this works. So now where are we heading or what's going on? You just don't know. Like my son, I don't know which homeopathic remedy in the 20 I gave him in a combination remedy. I don't know which one worked. So if that's, but the allergy's gone. He's got cats, dogs, none of that bothers him. So, if you get that point, hey, that's fine. But, he's got, mental issues and stuff going on. I think from his birth, because they said he was dead, and that, I don't know if oxygen was cut off. Luckily, a Indian doctor came by and put a stethoscope on him and said, no, I hear a heartbeat, So, anyways, that whole trauma, and that a lot of us, we don't realize what kind of trauma we might have went through at birth, We're never going to find out. We're never going to really know. But the idea is once you get down to that level, we're always a constitution. But that always can set up later on problems at birth, yeah. So, anyways, gingivitis, cracking of lips, sharpened, perverted sense, sometimes constipated, but more often pale yellow diarrhea, and it's fetid. It stinks. Tenesmus never feels like they said never feels like they're finished, so I just threw tenesmus in there. It is easy to use some of these big words. Yeah, I'd had to write a lot more stuff, but and you can see I started out with that pen. I said the heck with it. Let's open a new pen. Now I got a bunch of them, and I can just use them as underlines or whatever. But I just hate to waste anything. Cracked lips, chapped fingers, acne on the scalp and hairlines, seborrhea, which is the dandruff stuff, the more of a infection, peeling of skin like after scarlet fever. Now they had another word in there, disquamish. Yeah, something like that. That means peeling the skin. So I wrote it the other way, peeling of skin. I thought I keep using these big words. I want to make this, and that's the whole idea. That's why I'm doing on August 2nd. I'm doing that Zoom call, just a half hour, just 10 o'clock Saturday morning. Get on, ask me questions because I'm sure people are like, "What the heck?" Especially with some of these names. Anyways, the idea is as I get questions, and I don't really want to do cases or anything, but I just want to answer some questions about homeopathic medicine, see where people are at, so I can change maybe this format to do more. What do you want to say? Less technical stuff, and this really isn't that technical. You're just saying, hey, I got cracked lips. This person got chapped fingers, telling you that these doctors all took this in a hospital setting in 1957, and this is the symptoms they came up with. Acne on scalp, and see if we were doing that with a lot of the substance we had. Do it with plastic, and I probably do it with plastic every time I'm with somebody or give a person a medicine because they're ponding that, probably getting some plastic homeopathically uh, I don't know what you call plastico something or other. Call it. I'll give it a name, but I'm done with that. They're getting that plastic homeopotentized and getting little doses of that too. Maybe that's pop. Maybe that'll knock that plastic that they say we all have in our brain. A lot of weird stuff going on, but there's so much plastic. They say it's in us. It's in our brain. Yeah, of course the sea animals have it, but yeah. So, anyways, who knows if that'll work? But we need to have more experimenting on this stuff to different items, different substances, just to keep up with what's really good. And if we did it in a hospital setting like they did over in Germany, I tell you what, we would have. And that's what's so surprising is I told that lady in Germany to get a medicine. She said, I need a prescription. So they take it serious over there, so they got their trained homeopaths, everything like that. Now, I'm just telling you, you can be and I talked to two ladies online, and they said they're lay homeopaths, and I said, yeah, me too. So they're not certified, they're not doing cases, they're not trying, they just wanted it for their family. When it worked, and they said, holy crap, I can't believe that worked like that. The doctors couldn't do nothing. And they start, and that's what Robin says, when we teach somebody and train somebody and they experience it, they're like, I got to know more about this. That's what happened to me. So if we were able to mainstream it and have people, actually can go to a doctor that could really do more deeper work, or a homeopathic doctor, you know, um, rather than, as a lay person. But a lot of people are really, really good. And I was on with a lady yesterday too, and she does agro homeopathy, which is plants. And that's what I was trying to use on mine. Rush of thoughts and inner rest, vomiting after drinking alcohol, sweat at night wakes them. They also have bad dreams, heat and headache and sweating wakes them. Heat with headache and sweating. Constant chilliness, flushes of heat. Sorry, constant chilliness, flushes of heat with headache and sweating. They sweat at night, wakes them. I should know I go backwards. Constant chilliness, flushes of heat. Okay. Itching with difficult swallowing as if inflamed, gray-white sputum with hot feeling. And they also have thyroid problems. So let's, quick comments. Where's the comments, man? Come on. It's the other page. Sorry. Let's see. Comments. Hypotrophic cirrhosis. So there's liver stuff with jaundice. Without jaundice, they don't have that yellow look to them. Viral hepatitis. So there's anybody having hepatitis. Aranea, Ixobola. Where is it? Atony of the gallbladder. So that's hardening of the gallbladder, not working. Acute inflammation of the gallbladder, chronic cholecystitis without the formation of stones. So they don't actually have the stones, but that cholecystitis in the gallbladder. Gallstones, fibrocystis disease of the pancreas. Chronic pancreatitis, cystic fibrosis of the pancreas. Anybody having cystic fibrosis or cirrhosis of the bladder? An enlargement of the spleen. So that's why there's all that digestive stuff going on, and it's probably, they can't handle none of the fats, meats, nothing like that. Now these people took it, got these symptoms. If someone was having those symptoms and I gave this medicine to them, that would cause the vital force to fight that medicine. And the body would heal itself and throw off whatever the sickness, wherever this came from, whatever the disease was, whatever it was. So you'd be looking at this person as a gastric situation with headaches and diarrhea and this stuff and that, and from there, heart vascular stuff going on, thyroid stuff going on. You look at all that stuff, and you're realizing where it is. The center is the stomach, and then it radiates out. Rheumatism, probably a lot of acidic stuff. Not throwing off the acids and that. So I imagine we're repairing the gallbladder and stuff like that by giving them this medicine. So that is morning medicine. You can age, but you don't have to get old.